Hello everyone and welcome to Skills in Scrubs. Today we will be discussing about the worst part of first year, that is histology slides. I know each one of you have struggled in identifying those slides, so I'll help you to identify each tissue and those points that you should be writing in your exam to score perfect marks. So stick around till the last slide and don't forget to subscribe to my channel. So today we will be learning about the GIT, that is gastrointestinal tract, and the first slide in this system is the esophagus. So in esophagus we will see the 5 points which are necessary to write in your exam. The first and the foremost point is that the lining of the esophagus is by stratified squamous non-keratinized epithelium. The muscularis mucosa is well developed in case of esophagus for proper peristaltic movement through the esophagus. The third point to note here is there is no gland in case of this slide in the submucosal layer, whereas some of the tissue might show submucosal gland. The fourth point is that in muscularis layer you can find out two types of layer. There is longitudinal layer and there is circular layer. So both layers are present in case of muscularis. And the last but not the least is the adventitia or the serosa layer. The adventitia layer is present in case of near the trachea and the serosa layer at the lower end of the esophagus. In this slide, you can note the presence of gland in case of the submucosal layer. These are the glands which are present in the lower part of the esophagus and can be used as identifying feature for the tissue with glands. The second slide is of stomach, and stomach is lined by simple columnar epithelium all around. These are the mucus secreting cells that help in maintaining the integrity of stomach when acid is secreted. Second thing you can note is the gastric pit. These are more deeper in case of pylorus than in case of fundus. The third thing you can note is that the muscularis layer of stomach has three layers: the longitudinal layer, the middle circular layer, and the oblique layer in the inner side. The third thing you should be noting about the gastric glands in case of stomach is that they contain two types of cells. The chief cells are basophilic and second are the parietal cells which are acidophilic. The fifth thing that you should be noting is that the pyloric glands have more amount of the mucus secreting cells with minimum parietal cells and chief cells. So let's proceed with the third slide for today, that is duodenum. So how can you identify a slide of duodenum? First, look for the lumen. Once you find the lumen, it is part of the GIT. Second thing you should be looking is the villus. The villi are broader and leaf-shaped with a core of lamina propria. Here you can note the lamina propria. The third thing that you should be looking is the crypts of lubricant. These crypts are present in case of the mucosa and you can easily identify them. The next thing that you should be looking for are the submucosal glands. These glands are also known as the Berners gland, which are present in case of the submucosa of duodenum. The next thing that is most important is the muscularis layer. There are two layers of muscularis, that is inner circular and the outer longitudinal layer. The last thing that you should be noting in case of the duodenum is the lining. The lining of the duodenum is by the simple columnar tissue and you can identify it very easily. The fourth slide for today is jejunum. Now, the jejunum is lined by again simple columnar epithelium cells. Hence, it is also similar to the duodenum, but the differentiating part here is the goblet cells which are present in case of the jejunum and which are absent or least in case of the duodenum. The next thing that you should be looking is the submucosa doesn't have any Berners gland, hence it is a differentiating feature from duodenum. The villi in case of the jejunum are more like a finger than like a leaf, so it is also a differentiating part from the duodenum. The placa circularis are more prominent in the mucosa layer of jejunum. So don't forget to mention them in your points. Last but not the least, the crypts of lubricant are well developed in case of jejunum as compared to the duodenum. Moving on to the fifth slide for today, that is ileum with pairs patches. So what are pairs patches? These are the pairs patches that you can note in case of this slide. So pair patches are the lymphoid aggregates which are present in the submucosal layer of the ileum. The lining of the ileum is again by the simple columnar epithelium with an increased number of goblet cells which you can note over here. The next part is the villi are shorter and club shaped which you can note over here. You can also see that the crypts are present but those are not that deeper. The prominent muscularis layer separates the mucosa from the submucosa as it is a well developed layer in case of ileum. So don't forget to mention this point. So let's continue the sequence. Now comes the colon. It is the sixth slide that you should be worried about. Let's see what are the things you should be looking for in case of the slide of a colon. It is lined again by the simple columnar epithelium. So the same lining throughout the GIT. Just remember, the second point is very important. The crypts are straight and very deeper, and note that there is no presence of villi on the lining. Hence, it is a differentiating part as there is less absorption of nutrient in case of the large intestine. So there is absence of villi. The third thing you should be noting is that there is presence of abundant lymphoid tissue in case of the lamina propria. The next thing, that is the lumen of the large intestine is very wide and it is irregular. The last thing, that is the muscularis layer in case of the colon or the large intestine is very thick and has 3 bands of longitudinal muscles. The 3 bands of longitudinal muscles known as tinea coli. So remember to mention them in your points. The last slide for today is the appendix. The appendix is again lined by the simple columnar epithelium. The second thing that you should be knowing is there is abundant of the lymphoid aggregates in case of the appendix. Those are known as numerous lymphoid follicles in the layer of the submucosa. So don't forget to mention this point. The third thing that you should be noting, the crypts of lubricants are very few and are very irregular. Here you can see them. The muscularis externa has an incomplete outer longitudinal layer and hence it is the differentiating part from the large intestine and small intestine. Then you can see the lumen of the appendix is small, irregular due to folds. These are the 5 differentiating points for the appendix that you should not be missing on. Don't forget to subscribe to my channel and we'll meet tomorrow with another system and all the slides from that system. So stay tuned for more. See you soon.